Με την άδειά σας θα μιλήσω στα αγγλικά και θα σας μοιράζω λίγο από την εμπειρία μας πάνω σε αυτό το πακέτο. So our effort was to look at the needs of primary care physicians, understanding that training was lacking in the area of NAFLD and the management and the role specifically of primary care. I'll talk a little bit about the development process, the actual tools that resulted from this, how they were used in a pilot testing that occurred. We've already acknowledged the partners on this particular work package. And we had two tasks. One, to develop a very strong, if you will, educational program based on the learning needs of GPs, of which even the GPs themselves perhaps hadn't thought about and to a great extent. So we work with a task group, I'll show you the names in a moment, of international nature, the best in the field, but alongside them GPs that would be using the e-learning to identify what really were the learning needs, what was the, if you will, the concise information that was needed from a day-to-day perspective of a busy GP practice as it related to NAFLD. We adapted those learning needs into an e-learning, but also developed, if you will, tools that could be used for webinar delivery, for education, classic style in universities or for continuing medical education. And the idea is that we would end up with a learning package for webinars, e-learning that was pre-recorded, and for classroom-style education. We also wanted to pilot test, just to get a feel from the groups, the target audience, if we were meeting their learning needs, if we were improving their confidence in NAFLD delivery and aspects of that related to primary care, and if it was influencing their day-to-day practice as a result of the training. So we did a pre-post evaluation of a small sample of GPs. So really, we were looking to consolidate evidence, and there are clinical practice guidelines in this area, not specific though to GP practices or the primary care setting, certainly not to the pathways, protocols, and facilities that are in place in Greece and in the partner countries we were working with. Professor Leonis mentioned earlier our partner countries were the Netherlands, Spain, and Greece. So we really wanted to make sure any training that was developed understood the important role of contextualizing the training in what tests were available, what patient populations would be seen, and what the day-to-day practice roles would be in each setting. So that was the area of work we engaged in. We sought to develop a 30-minute e-learning. It ended up being quite a bit longer than that due to the learning needs. And likewise, the expert panel of names we'll follow now provided some oversight. So we worked with them to identify learning needs. We worked with them to understand the needs specifically as it related to content areas. We designed the training resources. They reviewed them, they critiqued them, and we worked in that manner of an iterative collaboration. The results of this e-learning are available in English, in Dutch, in Greek, and in Spanish. So the same core content adapted in language, but also adapted to the local pathways and some of the practices in each country by leaders from each of those countries. So names were mentioned earlier, but we had some leaders in primary care helping with that particular aspect. So from a process perspective, we scoped the work. We had 2 meetings of the expert panel. We designed the objectives, key messages. We had the working groups work carefully with us. We designed case studies with those working groups and content. We went to production with a professional company to bring graphics to life, animations around this training, translated, adapted, quality checked, and then pilot tested the materials and resources. And this is the names of the expert panel that worked with us. We were very privileged, as I mentioned, to have GPs, but 4 of the international experts in the area of NAFLD, both GPs but also specialists, join us. From Greece as well, we had 2 experts join us at the working table here as well. So it was really a privilege to work with this group, and a wonderfully engaged conversation of how we take guidelines in practice for NAFLD, but bring them down to what the GP or family physician needs to know from their day-to-day perspective. We did a needs assessment, and we did that from the work that Dr. Yaryanaki is going to report back to us. So that was having survey work done with patients and general practitioners in all of the countries we talked about. We also used our expert panel to identify needs. And really what we identified was the need to change GP attitudes about their role and the importance of NAFLD, that wasn't well understood, and I think that has been spoken to already. The position of liver disease as a metabolic disease. That this doesn't need to be a lot of new work. It's work that GPs are already doing, but requires some consideration of screening and working with specialist care. reducing the complexity and confusion around test and clinical assessment, diagnosis and referral. Who do I refer? When do I refer? And then what is my role once I return from specialists in managing long-term NAFLD and also NASH? And focusing again on the information GPs wanted to know. How frequently, which tests, which patients, and where do I focus my energy were the questions that came forward. Coordinated care with specialists what was emphasized, and reflecting local protocols, and then lifestyle change. So a lot to do with treatment of this particular disease area is not medication-based, it's not pharmacological, there is a component of that, it's lifestyle-based, and so there is a module of the e-learning that addresses that, that focuses on lifestyle change, and the GP's role in screening and advising on that. So the title of the e-learning is NAFLD, What Every GP and Primary Care Provider Should Know. And these were the learning objectives. I won't go through them in detail. This is available now publicly, both at the University of Crete on our educational website, but also on the ESPCG website on their e-learning platform in all of the languages. So they've been able to promote it in Europe as a tool for GPs in the languages that we talked about. These are the 4 modules that were created to meet the learning needs. So one is an overview of fatty liver disease, NAFLD, and NASH, a very comprehensive of everything you need to know about why we care about this disease, which populations are affected, who are we concerned about with a particular focus on the obese, diabetic, and those with metabolic syndrome. Module 2 was about screening, risk assessment, and diagnosis. What are the tools, processes that are used, in particular reference, not what the specialist will use, but what a GP use in this process. And then addressing, if you will, treating NAFLD in primary care. What are the treatment strategies? How do we manage cardiovascular risk more carefully, because that's one of the primary strategies? And how do we work with the specialists around different populations, including algorithms for treatment. The last module was the one I spoke about a moment ago, focused on prevention and lifestyle counseling. And I just have a few slides from the e-learning. Here is the, if you will, the landing page of the ESPCG, where the e-learning is housed now. You can go there and access it. It should be of interest. Again, in Greek, so you just choose the language, choose our flag, and we'll be able to access that. These are the clinical case studies we developed together with our advisory group. We have 3 of them together, presenting with different aspects that would be seen in day-to-day primary care. And we walk through the 4 modules of the e-learning and really talk about how in each area, whether it be early diagnosis, screening, treatment, working with specialists, or addressing lifestyle change, how we looked at these 3 case studies. So they became the, if you will, focus of the e-learning. This is some examples of content that you'll see in the e-learning, just the quality of the graphics. We had the pleasure of working with a professional team. The algorithms that you'll find in the e-learning, some examples of them here. And of course, the education walks you through how to use these algorithms in day-to-day practice. And a little bit around some of the multidisciplinary approaches to treatment that are covered in the e-learning. An emphasis on lifestyle and dietary change, the management of alcohol, the management of cardiovascular risk factors is front and center. And at the time we were developing this work, some new practice guidelines were released around patient management and the role of patients and patient education in NAFLD, and that was used directly in the e-learning. The last module focuses a lot around motivational interviewing and the role of the GP in addressing, if you will, health behavior change. And so we walk through a number of scripts, a number of scenarios of how a GP may introduce a NAFLD. What is the health literacy aspect to explaining that in plain language, walking through sample scripts, talking about risk assessment and how results are explained, talking about the role and connection to lifestyle change, and we really go into a lot of detail around the patient-physician interaction in that last module. I mentioned we pilot tested in a sample of 50 in Greece and 50 in each of the 3 countries that were involved in this project. And I'll share with you just a little bit of the results very, very, very quickly. You can see here Spain, Greece, and in total, we asked the question, just as basic information, how many GPs had been exposed to NAFLD guidelines, a NAFLD CME, or some other form of education or training in NAFLD. And you can see the vast majority had not been exposed to any of these. So meaning the education we were developing was new, fresh, and filling an important gap. Satisfaction with the e-learning we evaluated alongside measures of clinical practice, and you can see here the program was highly rated. Certainly some room for improvement, but by and large rated very strongly by physicians in Greece and in Spain that you see on screen here. We also look at changes in GP NAFLD-related confidence. How confident do you perceive yourself to be in screening, in risk assessment, in diagnosis, in referral, and in management of NAFLD long-term in your practice. We looked at before, after, and 1 month following the training, so at 3 different time points. And we had a significant improvement in all of the confidence areas before and after the training, which is what we were looking to achieve. That was our goal. We also looked at clinical practice behavior. So how frequently are you now screening before and after the training? And again, the 3 time points were used again. And are you referring to specialists more frequently and engaging in counseling as it related to a healthy lifestyle? And here again, we saw a particular change before and after the exposure to the short e-learning in GP's practices, with 62.4 reporting the CMA had changed and had an influence on their clinical practice. So just a small pilot sample. We were able to publish the results very recently in Frontier in Medicine, mostly because there isn't any e-learning out there. Since our work, there has actually been a second e-learning focused on GPs released at a European level. So you can see the gap being identified. So in conclusion, we've got a new training asset tailored and carefully designed with some pilot testing for GPs. It's an asset that can be used here in Greece. It's publicly available, but also has implications outside of Greece in the European setting. And my thanks to the team that collaborated on this initiative. Thank you.
Ενώ ετοιμάζεται η κυρία Γεριανάκη, να σας ευχαριστήσουμε πολύ, κυρία Παπαδάκη. Καθίστε. Ήταν μια εξαιρετική παρουσίαση. Αυτά που θα μου επιτρέψετε να υπογραμμίσουμε είναι ότι πραγματικά επιχειρήσαμε να δούμε τις διαφορές στην ανάπτυξη ενός προγράμματος, όχι μόνο στις διαδικασίες, αλλά και στην εφαρμογή εκπαιδευτικού προγράμματος σε 3 χώρες που είναι διαφορετικές, Ισπανία, Ελλάδα και Ολλανδία, αλλά και κυρίως, και ευχαριστούμε πάρα πολύ την ομάδα του Πανεπιστημίου Κρήτης, γιατί αν μη τι άλλο ενσωμάτωσε μέσα στην διαχείριση του προβλήματος και στο εκπαιδευτικό πρόγραμμα κυρίως τεχνικές συμβουλευτικής, επικοινωνίας και αλλαγής της συμπεριφοράς, και είδατε πόσο μεγάλη σημασία είναι η ενθάρρυνση και η υπερτροπή, αυτό που ακούγεται ως motivational interview.